I'm Dr. Brandon Kale from Moffitt Cancer Center here at ASH. I'd like to talk a little bit about my poster. BCMA-directed CAR T-cell therapy has revolutionized the treatment of multiple myeloma. However, some patients still relapse after therapy. So we want to identify markers that we can use to predict which patients are at risk for relapse. Here we looked at next-generation sequencing-based minimal residual disease assessments, specifically the ClonoSEQ assay, which is able to detect 1 in 100,000 multiple myeloma cells. And we looked at NGS MRD testing at day-90 after CAR T-cell therapy. We had 171 patients that we were able to analyze. We split them into two groups based on their MRD status, so whether they were NGS MRD negative or NGS MRD positive. And here the baseline characteristics are pretty similar for the two groups. These were about half and half male-female. A majority of them had high-risk cytogenetics, were heavily pre-treated with 5 lines of therapy. The only real differences here between the two MRD negative and positive were the number of patients that had received cilta-cel. So MRD negative patients were more likely to have received cilta-cel in prior autologous transplant. But when we look at the survival based on their MRD status, we can see a clear separation here in PFS and OS between the MRD negative and positive. So for progression-free survival was significantly longer in the MRD negative at 20 versus 11 months, as was overall survival 38 versus 26 months. And this held true across different response criteria. When we control for intervening variables here in the multivariable analysis, we can see that even MRD negativity remains associated with improved survival.